So what you've seen now is a few bits and bobs that you can do yourself to release muscles if you're in pain or if you want to prevent pain. I'm not a doctor. If you do fuck up, it's not my fault. If you do have problems, real problems, go see someone. Hi, my name is Evelina and I'm from Strom. I'm a chiropractor and I'm a powerlifter. I got a master's degree in chiropractic and I spent 5 years in college, and I've spent 7 years in powerlifting. So what is pain? Pain is essentially a symptom. And we can go about pain in two different ways. We can treat the pain, which is a short-term fix, and we can treat the cause of the pain, which is the long-term fix. A lot of people get that wrong and they just chase the pain. Whereas if you think about long-term benefits, you look for the cause of it. So when you have a pain, you should ask yourself a few questions. First, where is the pain? How bad is the pain? What kind of pain do you have? What triggers the pain? And what makes the pain better? So there's a few key areas that people usually get pain in. It's your shoulder, your low back, your hip, and your knee. These are the most common areas that I see people have pain in, so we're going to cover that today. And there's also a few key muscles we're going to go through, some stretches, some releases, just to either help you if you have pain, or reduce your pain, or help prevent pain or injuries. A few areas that most people have problems with, and because you two are very different.
I am exactly the same as him.
So basically,
Yeah, you have the
whatever
same
I
bench.
don't have issues with.
Yeah,
You
you're
will have.
more likely to have issues with, because yeah.
Okay, but just to be clear, we're the same size.
Yeah, well, I'm the same size as you too, so.
Okay, fine, yeah.
Okay, so we're gonna start with the shoulder. The best way to check your shoulders is to check the range of motion. So if you get your hands up like that, your hands fully up.
My snail claws popped up.
I'm trying to suck mine in.
So you can see Reese's shoulders are a little bit stiffer.
What are you on about?
And then if you go forward like that.
What?
So from down
Yeah, from down to up.
and then
Easy.
Exactly. So you should be able to do 180 degrees, which
Easy.
Reese is a little bit stiffer.
what are you on about?
And
I
then
can
if
do
you
more.
get your hands like that, go down. So you should be able to get to 45 degrees, and they're both stiff. Same again, 45 degrees.
Hang on, can I?
I've
just clicked. So no thoracic extension.
Exactly, like that. So you can see Rick is fine, you're a little bit
Fine.
stiffer.
Fine.
So that's the best way to just check tightness.
Muscle mass.
Exactly. Tensioness. So that's the best way to just check how your shoulders are doing in terms of mobility and muscle tightness. So we're gonna fix what's wrong with you. Yeah, so this is supposed to be a ball. It's not, but just pretend it is.
Okay.
So we're gonna go to a wall, and then you get arm like that. You find a spot where it's kind of painful, and then you move your arm up like that.
So this is right in from the armpit area.
So you push your arm back.
So you're trying to keep your elbow close to the wall.
Yeah,
Okay.
exactly. Some people will be really, really tender, so don't put too much pressure on, but just as much pressure as feels comfortable, but you can feel it.
Yeah, I imagine I'm going to have to build up to it. This is probably going to be tight
Yeah.
as fuck.
If you try that.
So this is the side we did.
Yeah,
So this should be loosey-goosey now,
technically.
theoretically, unless I just cocked it all up. So
Did you see? It's not really the same. And then if you get arms like that,
right.
so you can see that's going further backwards than that one is.
Yep.
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 Right. Okay. So if you have a seat on the chair, you're gonna get into the subscap, which is in your armpit.
I've experienced this.
Yeah. So if you have someone to help you do this, that's great. You can do it yourself, but it will be quite hard. Right. Arms out like that. and down.
Yeah.
And you can see that's stiffer and that's not. So
Okay. So
just you can make a big difference with just a little bit of soft tissue work. And obviously, if you can have a range of motion that's near enough full, then that will reduce the risk of injury, and it will help you perform exercises correctly.
yes.
With. So you stand 10 centimeters from the wall, your bum, your mid-back, your head is against the wall, you get your elbows and this bit, part of your wrist against the wall, and then that creates a gap in the smaller lower back, and the goal is to just push in and make that gap disappear.
I'm gonna do this so
And-
you can see my gap.
A little bit further in.
What?
No, I said a little bit, not fully. 10 centimeters from the wall.
Okay.
Elbows and this part of your wrist. You see, can't even touch the wrist. So I mean, this mid back is really, really stiff.
Right, and then
That's the test. So you fell.
so I'm trying to touch my back.
Yeah, this bit here. You should be
So
able
you're
to.
trying to like what, flatten out your.
Yeah, flatten out the low back. And you can see I can get my hand in.
Is
very
my hands
easily.
allowed to come off the top?
No, it is a big. Okay, don't even try. You fell.
Fucking hell. Alright, I'll go fuck myself.
Centimeters.
Right. So. We'll look here.
Yeah, bum, mid back,
Right.
head, and then this bit. Yeah, so your mid back is really stiff as well. You can,
Yeah.
yeah, you can get a whole hand.
A
in it.
whole hand.
A whole hand.
I can't even
yeah.
get back. Yeah. It's just. There's no way.
Yeah. No.
Yeah, so that means that your mid back is really stiff. It's very common, especially when people sit all day when they hunch over like that.
And when they're massive.
Well, you're not massive, so.
It's literally in my gym.
Improve your mid back mobility. What you can do each day is to use a foam roller. That will improve it can loosen up the joints and the muscles in your mid back. So you put it on the floor. You have the foam roller against your mid back, kind of a little bit far down, and then you put your arms like that. So what can happen is you can feel clicks or you can hear clicks. That's completely normal. It's just the joints releasing.
My core is not super strong.
Which is why he's got lower back pain.
Okay. So I have to. Here.
Yeah.
You're not shaking enough.
Oh, hang on. Oh, yeah, got the clicks up. Oh, I'm so mobile.
Average. Right, releases for the low back. Again, foam roller or lacrosse ball or tennis ball or anything that you can put on your ass.
We.
You're not helping.
No, not really.
Oosh. On your bed. Good girl. On your bed.
Right, so the first one is for your glutes. So you sit on the foam roller or a tennis ball and you kind of lean a little bit to the side so you hit the glutes. And then you roll up and down over a painful area. What you can do as well is you can do this kind of movement. Or this as well. And you do that on both sides. And then for your directly on your low back, you lean on the side again over your low back area. And you just roll up and down. And again, if you find a tennis spot, just stay on that for a little bit. You can do it on both sides, and about 2 minutes each side. Some people are really sensitive, so they can't handle more than a minute. Some people need 3 or 4 minutes. It's completely up to you. Try 1 minute, see how you feel. If you want to do more, do more. So it's very individual how you respond. We're going to check how the hip move to see if there's a restriction in movement, and then we're going to look at how to release what's tight. You can test this yourself without anyone helping you. So you bend your knee. So you have your knee bent, and then this is internal rotation. That should be 45 degrees to there, and that's a little bit It's not too stiff, but a little bit. Is that painful?
No,
No.
good.
Right, and then we're gonna do the other way. How's that?
No pain.
And again, it's about 45 degrees. Is good movement. So internal rotation. How's that?
That's okay.
This has a little bit more give in it.
Does
I don't
it?
know if you can feel the difference between them.
Right.
It kind of makes sense with your what you're describing your symptoms, but that side is stiffer.
Yeah.
So what you can do is, so we want to release. We've released the outside of your hip, so now we're going to do the front and the inside of your hip. So the best way to do this, just lie on your foam roller like that, and again just roll back and forth, and you can just rotate your body as well to hit different angles. So a foam roller is the best way to do it. If you have a tennis ball or a lacrosse ball, that will be a lot more painful.
Yeah, because it's...
Smaller.
yeah, surface area.
So yeah, just roll up and down. If you find a tennis spot, a specific point, just lean on that for a bit.
What if the whole thing's tender?
Yeah, just roll through the whole thing. If you're in pain, it's good to do releases every day or every 2-3 days, depending on how tender you get after the releases. And if you're training lower body, for example, it might be a good idea to do releases before you train to make sure that you feel loose enough to perform a good movement. So for your hip, another really good thing to do is the couch stretch. So it stretches the iliopsoas. The iliopsoas attaches from your lower back and it goes around and inside into your hip joint. If that gets tight, usually when we sit down, it pulls your hip into its socket like that. So because it goes, it attaches onto the femur. So when it gets tight, it just does that to the whole hip joint. It can cause I don't know how to say it. It can cause degeneration of your hip, for example, and it can cause a lot of issues. So we're going to stretch that, and this is something you can do every day. So the goal is to get your heel towards your glute, and you want to make sure that your lower back is straight. So this is not straight. This is your lower back being straight. And you should feel a stretch on the front of your leg. What's important, and a lot of people forget about this or they don't know about this, is when you do stretch, you need to do it for 30 seconds. If it's less than 30 seconds, the muscle doesn't have enough time to release. So what you want to do is you want to do 30 seconds one side, 30 seconds the other, and you want to do 3 to 5 times each leg, and that will give you the best result.